Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about changes in bowel habits during pregnancy. Pregnancy can be pretty uncomfortable and your body's changing quite dramatically, and it's very common to experience a significant change in your bowel habits. Switching from constipation to diarrhea, experiencing a lot more gas, and you'll see my other video on reflux or GERD, gastroesophageal reflux. So that's a separate video. So what can you do about these changes? Well, first, anticipate that they're going to happen. The hormones in pregnancy make your intestines work slower, and that can happen pretty quickly. So you'll notice a change in your bowel habits. Plus, the vitamins can be constipating. And because of the nausea in the initial part of the pregnancy, your diet may change, and that can also affect things. So if you're experiencing constipation, we encourage you to consider taking a stool softener, generic stool softener. Colace is a brand name. That helps your stools retain more water, makes them a little mushier. Having some fiber is good as well. Sometimes when you're having loose stools, you go for many days and you feel constipated, especially later in pregnancy, and then you have loose stools, you think you have diarrhea, but what you're having is so much constipation that the only thing that can get around is the loose stools. So sometimes when you have the loose stools, you still need a stool softener, okay? There's a good acronym to remember for kids when they have diarrhea that's called the BRAT diet: bananas, rice, applesauce, and toast. You can use those as well. So if you're having looser stools, you can go to those foods, or maybe if you're having too much constipation, then you might want to try cutting back on that. Another thing that can help you significantly is to really chew your food and try to break up your meals into 6 small meals. Also, we encourage you to have a little bit more protein from beef, like steak, hamburger, if you're anemic. But that can be constipating, and so can iron pills. So if you're given some iron pills, then you might want to take the stool softener with those right at the same time. Those are some general things. If you have severe cases in either direction, be sure to discuss this with your physician. And also, if you've had recent antibiotics and you have an extreme amount of diarrhea, want to mention that to your physician as well, not something to wait for. I hope you found this useful, and please feel free to leave questions. Thank you.